is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, the Commissioner for Veterans, Adrian Garcia, Harris County Precinct 2, and the VHA Office of Homeless. My name is True Lester Pauling. I am the Senior Outreach Specialist in CFBNP. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. The presentation will be sent to everyone that joined the webinar today. This is a live recording. I would like to thank Mr. Lauronzo, Garmon, and Mr. Shawn for this office presentation today and for this collaboration. We are grateful for your time today. Before we get started, I would like to introduce Mr. Conrad Washington, Director of the VA Center for Faith-Based and Neighborhood Partnerships, for some welcoming remarks. Mr. Washington serves as the Director for the VA Center for Faith-Based and Neighborhood Partnerships. He retired from the United States Marine Corps with over 20 years of active duty service with a combat tour in 2004 in support of Operation Iraqi Freedom II. Mr. Washington is a licensed minister actively serving in his faith. He received his master's degree of divinity in pastoral studies from Moody Theological Seminary. He also holds an MA in business management and a bachelor's of science degree in education. In addition, he is a graduate of VA's class of 2017 Virtual Aspiring Leaders Program. At this time, I give you Mr. Washington.
Thank you, True. I appreciate it. I would like to first thank each of you for connecting with us on this Thursday and today, and ask that you join us in honoring our veterans across the nation for their unselfish service to our country. So to all veterans, no matter which branch you served or length of service, whether you're in combat or not, if you took an oath to defend this nation, we all salute you and thank you for protecting our freedom, because we know that freedom is absolutely not free. Additionally, I want to take a moment and also give a shout out and wish a happy 247th birthday to all United States Marines. Hoorah and Semper Fi. Now, our presenters today are very dynamic. I'm excited to connect with Shawn, a VA colleague of ours who's very knowledgeable, and also Lauronzo, who we've had on our webinars previously before. And so I'm excited about both of these gentlemen. I thank each of you for connecting with us and sharing your information, and we look forward to many, many more webinars of sharing information. Today, obviously, is on information and resources to aid in eliminating veteran homelessness. Veteran homelessness still exists, okay? It still exists. And as we approach cold weather in many parts of the nation, it becomes more and more prominent to many people. But homelessness exists all year round. But I think now it's really in the forefront of our minds because of the weather. But nonetheless, I look forward to the information being passed today. I hope that it's beneficial to each of you, and we thank you for joining us, and be blessed and enjoy today's webinar.
Thank you, Mr. Washington. At this time, I would like to introduce Mr. Lauronzo Garmon, who will provide some opening remarks. Please read his bio on the screen. Mr. Garmon is employed with the Commissioner of Harris County, Adrian Garcia, Precinct 2. Mr. Garmon has over 12 years of experience in both public and private sector. He managed various projects to include team building, professional development, strategic implementation, and company collaboration. Mr. Lauronzo has managed projects in the U.S. Army for deployment to and from Iraq, created and established sales teams with a focused B2B sale, and helped to develop a veterans employment team in Houston for the largest veteran service nonprofit in the country. He holds a master's degree from Colorado Tech University. At this time, I give you Mr. Lauronzo Garmon for opening remarks. Mr. Garmon.
Thank you very much, True, for allowing Precinct 2 to be a part of this. Thank you again, Mr. Washington. I first off want to say thank you to all the veterans, everyone out there who served their country selflessly. Thank you, truly. It's an honor to be on a part of this team. However, this is a team that theoretically should not exist. Homelessness and veteran are two words that should not come together. So I'm extremely proud to be a part of an operation who's seeking to eradicate that. Commissioner Garcia has made it a personal endeavor to see what can be done on our part to help end veteran homelessness. And with that backing, along with the VA, I'm confident that we will begin as a team to make large strides in ending homelessness within the veteran community. Thank you again, and we are here to help in any way possible. Right around the corner, just give us a call, 713-274-9570. Thank you again, Ms. Trump.
Thank you, Mr. Garmon. At this time, I would like to introduce our presenter for today, Mr. Shawn, who will be providing today's presentation. Please read a summary of his bio to the left of the screen. Mr. Liu is the Director of Communications for the VHA Homeless Programs Office. He is responsible for developing strategic communications that enhance efforts to prevent and end homelessness among veterans and their families. He is also the host of Ending Veteran Homelessness, a monthly podcast that offers a look into our nationwide efforts to help veterans experiencing and at risk of homelessness. In addition to his communications work, Shawn supports the development and implementation of national policies, plans, guidelines, and technical assistance for a variety of VA homeless programs and initiatives. He has, this summer marks Shawn's 13th year working with the VA. He holds a Bachelor of Arts in Psychology degree from Florida International University, a Master's of Social Work degree from Florida State University, and he is a licensed clinical social worker with the state of Florida. At this time, I give you our presenter for today, Mr. Shawn Liu.
Great. Thank you so much. Hello, everybody. Very, very special. And thank you to all the veterans who are listening in. Happy early Veterans Day. Really, really excited to be here with you today to talk about an issue that I'm super passionate about. And I hope that you will find passion with it too, and hope that you'll join us in our efforts to end veteran homelessness. Before I dive in, I would just want to do a full disclaimer. I live in Florida, and there is a hurricane that is passing through the state right now. The worst of the power fluctuations have seemed like they're past, but on the off chance that another wind gust knocks out power here, I'm going to dial in really quickly. So I just wanted to put that disclaimer out there. Thank you for your patience as we weather the storm, literally and figuratively. So yeah, want to share with you what we're doing at VA to address, reduce, and end veteran homelessness across the country. These are the things that we're going to talk about today over the course of the next, I don't know, I want to say like 30 to 45 minutes. Definitely want to leave some time at the end for your questions. First, I'm going to kick us off with some introductory concepts, some words, some nouns, some adjectives, just to kind of level set about what we mean when we say veteran homelessness, homeless veteran, ending veteran homelessness. What on earth do we mean when we say that? Then I want to give you some progress, give a progress update on how we're doing toward ending veteran homelessness. Give you also a little bit of a high-level overview of a goal that we've been working on right now, our permanent housing placement challenge. It's been our big focus in 2022, so really excited to share with you updates about that. Then the reason why you're all here, going to provide just a high-level overview of the programs and services that are available to veterans experiencing homelessness and housing instability, those who are at risk of homelessness. We're going to talk a little bit about how you, as a member of the public, as a member of the community, can help us out, have a couple opportunities to stay engaged and connected with us, and of course, time at the end for your questions. So with all that out of the way, let's go ahead and dive on into some introductory concepts. We should define our terms right out of the gate, right? So what do we mean when we say homeless veteran? We're going to unpack that right now. So homeless in this term is an adjective. And so for defining this particular adjective, homelessness, we actually draw our definition from something called the McKinney-Vento Act. This was a law that was passed way back in the 1980s when I was just a wee lad. And it actually was the first legislation that really addressed homelessness and provides us with the federal definition of homelessness. So it's thusly. if somebody is homeless, someone's experiencing homelessness, if they lack a fixed, regular, and adequate nighttime residence. And homelessness usually takes two main forms. You usually have sheltered homelessness, where folks will live in emergency shelters in something we call transitional housing programs, things that we call safe havens. During the COVID-19 pandemic, we also made great usage of things such as hotels and motels to provide really safer emergency shelter. Homelessness also takes the form of unsheltered, where people are living literally on the streets, literally in the woods, literally in encampments, under bridges, public or private places not ordinarily designated or used as shelter. One thing I want to pause real quick and just kind of acknowledge is that this federal definition here is really used for program eligibility. If you meet this term, we can then provide you services. But I want to acknowledge that for many folks out there, veterans included, this doesn't capture the full range of the homelessness experience, specifically for women veterans or other women people experiencing homelessness who experience homelessness as couch surfing or doubled up. This definition doesn't necessarily include that experience, and that can have some very frustrating implications for service delivery and access to services. So wanted to just let you know that we know that's a thing. We acknowledge it. We're working to really try to make sure that we provide services for everybody for the full range of the housing instability and homelessness experience. All right, that's homelessness. Let's talk about veteran now. Now, for those of you who are familiar with VA benefits and the definition of veteran for the purposes of services, you're probably noticing something a little bit weird with the definition that's on the screen. The definition here is pretty broad. I'm going to read it thusly. For our purposes, for ending veteran homelessness, we're talking about adults who have served in active duty in the armed forces, including those in active duty if they were originally from the reserves or the National Guard. And this is regardless of active duty time or the discharge status they received. And you're probably wondering, well, Shawn, wait, you're with the Healthcare Administration, the Center for Faith-Based and Neighborhood Partnerships is with the healthcare with VA. You provide healthcare benefits. This is way broader than healthcare benefits, and you would be right. When we look at ending veteran homelessness across the country, we want to make sure that we're casting a wide net as possible, that we're being as inclusive as possible. What that means is that many of the veterans that we are charged to help with as members of our communities may not necessarily be eligible for VHA healthcare benefits, for VA homeless programs, but we still collectively as communities need to provide solutions for all veterans, regardless of discharge status, regardless of active duty time. What that often relies on is partnerships with folks like you and other stakeholders who can help fill in those service gaps. All right, nouns and verbs, right? Homeless, adjective, noun. All right. Got that. Let's keep going. Oh, I can totally slow down a little bit in terms of my speech. I'm from Miami as well, so I talk a little bit fast. So you're probably wondering, Shawn, as you're slowing down, what causes veterans to be homeless? What would contribute to somebody, say if I am a family member or a friend who's veteran, what would cause them to be homeless? Great question. So when we think about the causes, we can look to the research. Now, this particular study that you see here, this was actually from 2015, and it was an analysis of veterans experiencing homelessness. And this study identified two categories of risk factors, right? Individual factors and system level factors. We're going to go over each of them one by one. When you think about the individual factors, right, these are things that are probably a little bit more intuitive to you. Things such as substance use disorders, lack of stable housing or employment, history of incarceration or criminal justice activity, lack of social support, estranged relationships, family hardship, right, and adverse childhood events. These are things that we otherwise intuit and kind of think, oh, well, yeah, Shawn, those make sense in terms of risk factors for homelessness. But it's not just those. We also recognize the importance of system level factors, environmental factors that can increase a veteran's risk of homelessness. Now, these are going to be things such as communities that may have a lack of affordable housing, communities that may have minimal or not a whole lot of economic opportunities, other neighborhood and cultural factors. So if you ever have a conversation about homelessness and the causes of homelessness, so often we want to kind of reduce it and simplify it down to, well, it's obviously got to be the substance addiction. It's obviously got to be the mental health. But what I hope you're picking up from this particular slide, that there's no one major cause of homelessness. And for any particular veteran at risk, it's the mix, it's the interplay of all of these different risk factors. Continuing on with the research, just to get a sense of what other factors or how else should we conceptualize veterans' risk for homelessness. This was a bit of an earlier research article. This was from 2013, and it was a review of 100,000 veterans reviewing their service history to try to get a sense of the factors that contributed to their homelessness. 100,000 veterans. So there were 4 risk factor profiles that they identified. The first one is probably, you're scratching your head reading it, like, Shawn, what are you talking about? Relatively few problems. Yeah, well, when you think about it, especially from the previous slide, the system level factors, right? Neighborhood factors, lack of affordable housing, lack of economic opportunities, right? Those are those neighborhood things that don't necessarily impact or not necessarily caused by the individual, but impact the individual. That's probably what's going on here. Then some of the other ones are a little bit more, well, yeah, that's kind of what I've anticipated. The next risk factor profile is substance use disorder and a mental health condition. For any of those clinically minded folks out here, this is what we call comorbid disorders, so substance abuse and mental health condition. Next is substance use disorder, incarceration history, and poverty, right? Probably feels a little bit more intuitive to you. And the last one is the disabling medical condition, right? So when you think about why veterans experience homelessness, it's a lot of different reasons. It's a mix. Now, this is not to say that if you don't have any of these problems, you may not actually end up homeless. There are a lot of things that might contribute, but these are the general risk factors that we see. All right, continuing on. I want to share with you some progress. The progress that we're making toward ending veteran homelessness. Now, one of the things I want to let you know that we're actually making a lot of really great progress. This slide is somewhat out of date, and I have some really, really late breaking news for you. We actually made some big announcements last week where we were able to update this slide. So in the past, I would say we've achieved a near 50% reduction in veteran homelessness, but literally last week, VA, our partners at the Department of Housing and Urban Development, and the United States Interagency Council on Homelessness announced preliminary results of what we call our point-in-time count, and it revealed a 55% reduction in veteran homelessness since 2010. So even more progress. We've actually hit that 55% mark. What that worked out to, this particular chart here reads that in 2020, we had 37,252 veterans experiencing homelessness on a given night in 2020. But in 2022, we had 33,136 veterans experiencing homelessness on a given night. Just to throw some more numbers at you, that's about 11% decrease from the 2020 number as well. Really, really important progress being made. But as Mr. Washington mentioned a little bit earlier, we're not done. One veteran experiencing homelessness is one too many. 50% or 55% is not 100%. So we still have more work to do. All right, let's continue on to the next slide, please. I got to see a couple of questions that are surfacing in the chat. I'm going to go through the progress really quickly, and then I'll pause a little bit to answer your questions, and then we'll keep it going. So I say the term ending veteran homelessness a lot. We even have a whole podcast that's called Ending Veteran Homelessness. What do we mean when we say that phrase? So one of the things that I want to acknowledge is that we're not saying that no veteran will ever experience a housing crisis ever again. That's a fantastic vision of the world. We're not quite there yet. And let's game this out for a second, right? Let's say I have a magic wand. I don't have a magic wand. But let's say I have a magic wand and I waved my magic wand and we housed literally every veteran all across the country who is experiencing homelessness, whether it's sheltered or unsheltered today. We housed them all. Yay! Congratulations, we did it. Press release, ticker tape parade, press conference, like celebration. What happens tomorrow? What happens the day after that? What happens the day after that? Which you're probably thinking to yourself, well, Shawn, another veteran's going to be homeless again. And you'd absolutely be correct. So we're not working on the day where, well, I mean, that's a little bit far off, but we're not saying that no veteran will experience a housing crisis again. What we are working towards, and what all of this effort is all about, is creating a robust system response across the country, in communities across the country, where two things will happen. Number one, that our communities can prevent homelessness among veterans whenever possible. We just stop it from happening. But two, in the event that it does happen, for those veterans, it's rare, brief, and non-reoccurring. It actually doesn't happen that often to many veterans anymore. If it does happen, it's for a short amount of time, and hopefully it's that one time in their life. That's the vision of the world that we're working towards. We prevent homelessness wherever possible, and in the event that does happen, it's rare, brief, and non-reoccurring. Now, as Ms. Pauling read off my bio, I've been actually working at this for many, many years of my career. I've actually been in homelessness my entire career. And when I was a younger social worker back in the day, one of the things that one of the kind of the phrases we would say a lot is, I'm working myself out of a job. We're at Homeless Services. We're going to be working ourselves out of a job. In the next couple slides, I'm going to share with you a list of communities that have actually done this thing. They've actually achieved an effective end to veteran homelessness, and it's fantastic. But what we learned from them over the last several years of not only achieving this particular milestone of achieving an effective end to veteran homelessness, that's hard. But sustaining the progress, keeping it going, keeping their systems just as robust, given all of the other factors that are going on right now, is just as hard, if not harder, than achieving this particular milestone. So we will still have more work to do. Hopefully our systems will look differently. Hopefully our partnerships will stay as robust, but we still have more work to do. The work of ending homelessness among veterans is not done yet. All right. This is not pie in the sky stuff. 83 communities, including 3 whole states, Virginia, Connecticut, and Delaware, have achieved an effective end to veteran homelessness, right? This is stuff that is happening in communities across the country. Speaking of communities across the country, this map of the United States right here, each blue star that you see represents a community that has achieved this milestone. But what you're probably also noticing is that this is not the whole map of dark blue stars. There's some spots that are missing. So we still have more work to do. Okay, let's keep going. I'm going to pause here really quickly. Actually, we're going to keep going and we'll take care of the questions towards the end. All right, so let's keep on. I want to share with you one of the major goals that we're working on this particular calendar year. This is a goal that the secretary put out for us, a permanent housing placement challenge. One of the things that's really important to notice when you look at charts like this, when you see declines this way, what this represents, what it really means on a day-to-day basis is that our communities, your partners at VA across the country are essentially able to house veterans faster than they become homeless, right? That's how you achieve these measurable reductions. But what we've seen over the last several years is something a little bit concerning. So I want to unpack this for you. Okay, so this is the point in time count chart again, showing year over year what the snapshot of veteran homelessness has been since 2010. So since 2010 to 2016, this encircled area, this represents about a 47% reduction in veteran homelessness, probably averaging about maybe like a reduction of 6 percentage points each year, nice and steady march downward. But here we see it kind of like shallowing out a little bit. There's still a reduction, but it's slowed down quite a bit. This represents from 2016 to 2020 about a 6% reduction. You actually see a couple upticks in there, right? What we realize is we got to do two things in order to really return back to progress. And what we've seen here, we didn't have it on the slide, but the late breaking news, the return back to progress is oftentimes a result of two main things. Number one, you prevent homelessness wherever possible, again. But two, you increase the number of veterans that are actually able to get housed and try to outpace with the number of veterans that you're housing each month, how many veterans become homeless. That's how you actually get ahead of this particular problem. So to help us revitalize our systems, to really, really refocus on what our staff across the country do well, which is housing homeless veterans, earlier this year, VA Secretary Dennis McDonough outlined a goal that we would achieve 38,000 permanent housing placements for veterans by the end of calendar year 2022. To put this into context, 38,000 is both close to the number of veterans identified in that 2020 snapshot on the point in time count that we just saw. But for any sports fans that are out here on this call right now, it's also what I've been told is the number of seats at Fenway Park. So if you close your eyes and imagine a stadium filled with veterans who were formerly homeless, now housed, at Fenway Park. That's the vision of the world that we're working towards this particular calendar year. One of the things that I'd love for you to know is that we're making pretty good progress as well. As of September 30th, we've achieved almost 31,000 permanent housing placements for veterans, achieving about 81% of the goal. We're pretty confident that we're both going to meet and exceed the goal by the end of the year. One of the things I want to acknowledge, though, it's completely dependent on the frontline staff, the dedicated staff, the hardworking staff across the country, our community partners, and folks like you who join us into this particular effort. So on behalf of VA, thanks for your support. All right, the meat and potatoes of this presentation. Let's talk about the resources that VA has to address veteran homelessness. All right. Want to let you know, again, I've said this phrase a couple times before, VA essentially serves as the backbone for the federal government's response to veteran homelessness. As such, we have a wide array of services, a broad continuum of services that addresses a full range of the housing instability to homelessness experience. We have prevention resources for veterans who are housed right now to either help stave off eviction or to prevent them from entering into homelessness, either in those sheltered or unsheltered situations, and try to keep them in housing with as much supportive services that we can. For those veterans who do become homeless, we have temporary housing, residential services that will provide a bed for them right now, today, so that they can keep out of the elements like the hurricane that's raging outside. For those veterans as well, as we get them onto their housing journey, we have permanent housing resources that provides either short or long-term rental subsidies. The rental subsidies makes the rent affordable for them based off of whatever their income is, and then provides light touch, moderate touch, or intensive counseling, case management, and other supportive services to make sure that now that they get housed, that they stay housed as well. So full range of services available. This slide is a little bit, if that one was, the one before was visual, this one's a little bit more busy. I call this the alphabet soup slide because it actually outlines all of the different programs. I'm not going to go into the huge list of them, definitely not going to go into like all the nitty gritty eligibility for it all. But the things that I want to let you know is that you can generally categorize the programs and services that we have into 4 main buckets. First bucket is outreach, engagement, assessment, and referral. This is the front door to our services. So if you ever wondered, well, I see a guy, he's on the street, he's flying a sign. How does he get connected to VA? Well, it's these particular programs here and services here that actually serve as that front door to connect that particular veteran that you saw to us. So we have outreach workers who go out into the communities, into shelters, at soup kitchens, right? Under bridges to physically meet with veterans where they're at. We have resources like one-stop shops that are situated strategically in downtown areas at select sites across the country. And these are like storefront services. A veteran can just walk in and start getting help right away. For those veterans who might have access to a phone, here's my phone right here, you can call the call center, right? We have a call center that's staffed 24 hours a day, 7 days a week. It has trained counselors who are standing by to talk to veterans right this moment and connect them to their local VA. If you recall a little bit earlier in the presentation, we were going over the research, and you actually saw on a couple different slides, history of incarceration on there as well. Criminal justice activity, criminal justice involvement, history of incarceration are huge risk factors for homelessness. So we even have programs that work with veterans in jails, prisons, and in court systems to make sure that they're getting connected to VA resources as well. I mentioned a little bit before, we have residential services, places that provide temporary, shorter term or mid-range temporary housing for veterans along with supportive services. We talked about those permanent housing resources as well. And of course, we also have specialty services. Now, these specialty services they don't fit super nicely into the different buckets, but they're critical. You don't need me to tell you how important employment is for financial stability, veteran and non-veteran alike, right? And so we have employment specialists all across the country whose job is to help get veterans connected to employment preparedness resources, and even develop veteran employment communities in their localities to really help support veterans as they're going through their job readiness, job preparedness, and ultimately employment journeys. And then, of course, we have something called our homeless patient aligned care teams. Now, this is just a fantastic type of program where it provides primary care that is customized. It's tailored for people who are experiencing literal unsheltered or sheltered homelessness right now. It's super accessible. The doctors have what we call small panel sizes to really spend a lot of time with veterans with their healthcare issues. It has open access, so no need for an appointment. You can just walk in and get primary care. It's a wonderful example of the system changing ourselves to be more responsive to a subpopulation based off of what we know about their challenges. It's fantastic stuff. You're probably wondering, well, Shawn, all of this is well and good, but that's the stuff that you're doing. How do we support? How do we pitch in and do our part? Great question. All right, let's talk about that right now. So first and foremost, whenever, if ever, you encounter a veteran experiencing homelessness, maybe it's somebody that you're walking by at the grocery store and they're asking for some change. Maybe it's somebody who's camping out in a downtown area. Maybe it's a family or friend. Especially if they've been out in the elements. First and foremost, be patient with them. They may not have had their basic needs met that day. Now, I'm going to just call myself out. If I haven't eaten today, I get hangry. If I don't get good sleep, I am kind of delirious, right? If I'm dehydrated, oof. Now, think about being out in the elements all the time, not camping, but literally like out in the elements, and how you might feel if you hadn't eaten yet, if you slept really, really bad or not at all last night, and you're just trying to get some help, right? So if you encounter a veteran experiencing homeless, be patient with them. Understand that if you're trying to get them connected to us, that they may not have a reliable means of communication as well. We've tried our best to provide as many smartphones out to veterans during the COVID-19 pandemic, but there's a good chance if you encounter a veteran experiencing homelessness after this call tomorrow, they may not have a phone on them. So you might want to, if you're going to support us, a neat thing might be to do is to help problem solve ways to them to stay in touch and to get them connected to us. And then last but not least is you want to instill hope, but not overpromise, right? And that's a kind of a sticky or narrow needle to thread, right? But so much about homeless services relies on hope, relies on people believing, the veterans that we're serving, believing that the programs and services can actually help them, help improve their lives, help them get whole again. But we also don't want to overpromise, and because the worst that we can do is break those promises, further break the trust, and then further discourage them from accessing services again and again, right? So just want to acknowledge the big one, if you want to take something away, be patient, right? Be patient. They may not have had their basic needs met. They may not have slept well. They may not have eaten today. If you want to, talk to us after this particular presentation, you got some ideas, maybe you want to get connected to your local VA, shoot us an email, homelessvets@va.gov. That actually comes to me and a couple other my colleagues as well. You can also visit us on our website, va.gov/homeless. I'm pretty sure you're going to get these slides out, but if you want to take like a screenshot or a shot with your phone, go ahead, homelessvets@va.gov. Another thing that we'd love for you to do, and actually at this part, I am actually going to, model this. If you'll go ahead and take out your phone right now and just, here's my phone. I'm just going to snap a picture of this screen right here. This is a number that if you really, really, really want to help, and you may not be a housing provider, you may not necessarily be a landlord, but you want to do your part, this is a really simple one. Put this number in your phone today. It's the National Call Center for Homeless Veterans, 877-424-3838. Have it handy. If on the off chance that you find a veteran or you have a family or friend who's who's experiencing housing instability, give them the number. 24 hours a day, 7 days a week, a trained counselor will be ready to talk to them right now and help get them connected to us. That's a really, really great way to do your part. Other opportunities to make an impact. Now, a lot of these are going to be for local opportunities. So this would be where we would connect you to your local VA medical center. But there are certain things that when we think about partnerships that are critical for us to partner with other nonprofits, private citizens, corporations as well, just because VA doesn't have the ability to provide these things. Some of these things we can, but not all of them. So this is going to be things like training for jobs, furniture, and other move-in essentials. Some of you may not necessarily realize, and I recently moved, but when I moved into here, I brought a whole lot of stuff with me. Think back to any time in your life where you've moved into a new place, but you actually didn't have anything to move with, and how barren and empty and kind of creepy that house or apartment may have felt until you started kind of building it out with decorations and furniture. A lot of our veterans experiencing homelessness don't have that. So the ability to provide furniture and other move-in essentials, toiletries, bed linens, etc. Food is another big one, especially we got Thanksgiving coming up. A lot of stakeholders and partners like to kind of, adopt a veteran family, provide turkey dinners. Transportation is something big, housing assistance, jobs, and increased access to healthcare, especially since, our charge, as I mentioned, works with veterans who are broader than those who are eligible for VA healthcare resources. One of the things that you might be familiar with is our homeless veteran stand downs. These are resource events that are wonderful volunteer opportunities. They happen at communities all across the country at different times over the year. So if you're curious about that, I encourage you to check out this link. This is our stand downs page. See if there's a stand down upcoming in your community or check back often. If you are a landlord or if you have housing units, renting to veterans is critical, so critical. We need housing units. All of the progress that you saw, in addition to being the work of dedicated staff, also relies on housing units that our veterans can rent, right? VA doesn't have the statutory ability to actually build housing units. We can't make apartment complexes. So we need housing from members of the community. If you're a landlord, consider renting to veterans. If you want to know more about how you can do so, shoot us an email, homelessvets@va.gov. Another resource to just let people be aware of, this particular resource we stood up when the CDC's eviction moratorium was discontinued, when it was struck down. So it's a resource page all about eviction prevention, right? So it has a lot of really great information here. It has the number to the call center, some other fantastic programs from the Treasury Department and VBA, va.gov/housing resources for eviction prevention. All right, we're winding down here. I think we're going to get into the Q&A section, which is fantastic. Just a couple more slides. Want to let you know different ways for you to stay engaged and connected to us. If you have been interested in anything that I've said today and you want to, just stay plugged in, first and foremost, subscribe to our newsletter. It's a great newsletter. Our next one is going to be going out next week, Tuesday. It's our newsletter. We put it out each month. Provides good news stories, a message from our executive director, Monica Diaz, grant opportunities, some health updates, et cetera. To subscribe, go to va.gov/homeless. This little gentleman right here with the wonderful smile behind the mask, his face pops up in a little overlay. You type in your email and you're good to go. Last but not least, you can also subscribe to our podcast. Each month we put out a podcast providing a demystified look of towards our efforts to ending veteran homelessness. There's a lot of programs. There's a lot of alphabet soup, super technical. Sometimes it goes over my head. But if you ever wanted kind of like a demystified look, a really accessible look, this podcast is for you. You can actually subscribe today, Apple Podcasts, Google Podcasts. It's on Spotify. Check it out. Our most recent episode was on jobs, on all of our employment services. So if you ever wondered, well, Shawn, I'm actually curious about the employment stuff. How do you guys get jobs? Our most recent episode of podcast is for you. The next episode will actually come out this coming Monday, and it's going to be on our telehomeless program, specifically how VA put things like these into the hands of veterans experiencing homelessness. It's another great episode. We encourage you to check it out. That's going to be next week. So if you don't want to miss it, subscribe today, Apple Podcasts, Google Podcasts, or Spotify. All right. That is all for me. With about 18 minutes or so, we can do some Q&A. And I think I've seen a lot of questions pop up into the chat.
Thank you so much, Shawn, for that presentation. And we're going to go ahead and get to those questions because we have quite a few here. Just so everyone, our audience know, if we don't have time to get around to your questions today, we will get those questions directly to Mr. Shawn, and he will provide a direct response to you. First question is coming from Margot Settles. She says, my husband, a Maine veteran and a licensed social worker, have a home we are dedicating to homeless vets in Baltimore, Maryland. We have tried to get the word out as well as understand the resources connected with vets. How do we connect with to receive referrals? We want to help Our program is called Vets IOU, and our grand opening is tomorrow. It's a 7-bedroom home, newly renovated.
Yeah, that's a really, really great question, and really appreciate. Thank you for your husband for his service. Really appreciate the interest in partnering. The best way, the easiest way, just shoot me an email. homelessvets@va.gov. I'll get you connected to I believe it's the Baltimore VA healthcare system, and get you connected to the homeless program leads there, so you can start talking about referral process, eligibility, all that good stuff.
Okay, thank you so much, Shawn. Our next question is coming from Mr. Justin Cohen. He would like to connect to local outreach workers. He'd like to help and also have their contact info so he can assist. And we can, if you'd like to respond to that.
Yeah, that's another really, really great one. Again, same kind of thing. And actually, it's like a twofold. Number one, shoot me an email, homelessvets@va.gov. When you do, let me know your city and state, and I will connect you with the homeless program leads at your local VA medical center. You could also hold, just, like I mentioned a little bit before, jot down and keep handy the national call center number, especially if it's on like a Sunday or a Saturday. That's a really, really easy way to get those veterans that you encounter on our radar. So 2 ways. Number one, homelessvets@va.gov. Shoot me an email. We can start getting you to develop a relationship. But number 2, keep that call center number handy, especially if it's a kind of an after hours thing.
Thank you. Next question from Mr. Alan Mulder. Greetings, Mr. Liu. Thanks for everything you do to help our veterans. My question to you is, you talk about the veterans, but what about their family? What programs and pathways to assist do you have for them?
That's a really great question. And I'm going to kind of unpack it a little bit and answer it in 2 ways, because there's a couple of ways we can go with this. So the first one is that one of the things I want to acknowledge is that many of our programs can serve whole households, not just the veterans. So if we're talking about maybe a veteran and they have a spouse and maybe some dependents, maybe a grandparent or whatever, and it's like an intact household or family, a lot of our programs can actually serve the whole household as well, so long as there's one eligible veteran. So in those instances, if we're talking about a household, like we have no interest in separating them, we want to keep them intact, and that's great. So, same kind of things apply. Connect them to our call center, we'll help them out. If we're talking about a family and there is no eligible veteran in the household, that's a situation where we would work to get them connected to community resources. Our social workers across the country are very well connected with what we call, this is jargony, but it's continuums of care. These are organizations that serve as the general homelessness services leads in your communities. And in those instances, if they connected to us with VA, but there was no eligible veteran in the household, we would do everything that we could to get them connected to the local community resources.
Thank you. Next question from Mr. Bill Ashton. What is the definition of point in time? You said 33,000 today, but that can go up tomorrow.
Yeah, that's a really great question. That's a fantastic question. And you're absolutely right. So let's talk about this, what it means literally, and then kind of how we use it to think about the progress that we're doing and how members of the community should really think about it too. So first and foremost, when we talk about the point in time, what we're talking about is a snapshot, right? If you think about the calendar year, 365 days in a year, we're talking about one night in a year. What did veteran homelessness look like on that night? So on the charts that you saw a little bit earlier, and anytime we talk about like the number of veterans experiencing homelessness, what you'll usually hear us say is on a given night, or on a night in January, or the snapshot or the estimate. So you can see here the fuzziness and kind of hedge bending because it's exactly that. It's a snapshot. It's not the number of veterans experiencing homelessness right now. And it's not the total number of veterans who have experienced homelessness over a given time period. So that's kind of what it means. It's just a snapshot. It's not a perfect estimate, but it's a pretty good estimate. And it's one that we've been using that we believe is a meaningful way of measuring progress year over year. Now, to get to the other part of your question, or the other kind of underlying bit, which is the number of veterans experiencing homelessness at any given day over the course of the year could vacillate. It could go up or down from that. You're absolutely right. And when you think about over the course of a calendar year, what we usually do is, as a rule of thumb, is we apply a sort of multiplier to, which is about maybe 2.5 to 3 times whatever the pit count is. That's how we sort of eyeball or estimate how many veterans may experience homelessness and thus need services over the course of a whole year. So as you're correct in pointing out, that number right now is probably way different from when it was in January, but that over the course of a year, we would see maybe 2.5 to 3 times whatever the pit count was, whatever that was, experiencing homelessness. That was a super technical answer, but I hope that got to the spirit of your question.
Thank you so much, Shawn. We got about 4 more questions. The next one is coming from Brendan Dowling. Is homeless, and information about this discussed in TAPS for our transitioning service members? Do we talk about SNAP to veterans?
That's a great question. So I want to just kind of acknowledge, I don't have good visibility into the robustness of this homeless service resources for transitioning service members, but I do know that it is a very, very important topic. It is on our radar. I just can't speak to the details, but I do know that is something that is very, very important to VA and the Homeless Programs Office, is making sure that veterans, as they transition from military service to civilian life, and they're experiencing or maybe at risk of housing instability or even homelessness, that they're getting connected to us as well. And yes, we also do talk about SNAP benefits. I can't remember the acronym. I think it was Supplemental Nutrition Assistance Program, or SNAP, AKA food stamps. And yeah, when appropriate, our social workers across the country do help veterans get connected to both SNAP, food stamps, and other mainstream benefits that they will be eligible for.
Now, TAPS is a DoD program, correct?
I think it's actually, let's go look it up real quickly. I think it's Department of Agriculture.
Program, because when the military service member transition out of the military, they have that briefing, that TAP briefing.
Yeah, so TAPS is DoD, transitioning service member, I think, is DoD Joint VA, and then SNAP should be, I think, Department of Agriculture.
Okay, great.
I might be lying.
3 more questions. Next question coming again from Mr. Bill Ashton. What happens when you or one of your VA workers approach a homeless veteran and he or she says they don't want help, they are happy living on the streets?
You're asking so many really great questions. That's a wonderful question. Because this really gets to a myth that I think a lot of people have, which is that people choose to be homeless. And I don't believe that myth for a second. But what, Bill, you're pointing out, which is just the best question, is, well, like, if they're saying no to us and we're providing services, like, what do we do? Do we just leave them be? And the answer is no, we don't leave them be. Our systems are especially some of our more kind of modern and advanced communities, have systems and infrastructure to keep tabs on those veterans so that we can keep coming back to them and asking. They have a right to say no. We have an obligation to not give up on them. We have an obligation to keep going back to them over and over and over again, because today may not be the day. Tomorrow may not be the day, but you know what? The next day after that, it might be. But if we give up on them and we don't keep going back, the day that they might actually say yes, if we're not there to really, really jump on that and really get them going, we might have missed our opportunity. So again, veterans have the right to tell us no. That's totally cool. We have an obligation to keep going back. And that's what our staff do. We keep going back and we keep going back and we keep going back, and we don't give up on them until one day they finally say yes, and then we get them into services. Really, really great question. I'm really glad you asked that one.
And he asked one other question. There are a lot of grants for this issue. How do we really check the return on investment?
That's another really great question as well. So this gets super weedy, so I apologize, but we actually do have performance metrics that evaluate the effectiveness of our programs. Generally speaking, a lot of our housing programs are really, really effective, especially when it comes to veterans exiting our programs. They're just done, but exiting, remaining in permanent housing. And then what we also see here as well is that with the the new kind of decline in veteran homelessness, kind of more of those indicators of the effectiveness of the work that we're doing. To the kind of the underlying spirit of your question, there are often times where what we are doing doesn't have a one-to-one correlation with, like, say, well, therefore we're investing this many dollars into communities or whatnot, but we are changing lives really, really, really importantly. So in addition to kind of the performance metrics, I do think, you know, the more anecdotal and testimonial, the qualitative components of the success of the programs is something that we're really excited about. We do have, if anybody's curious, and we can probably make this available as a follow-up, we have a link to our fiscal year 2021 annual report. So you could see just some of the outcomes, the return on the investment. We're actually working on our fiscal year 2022 annual report right now with some more performance outcomes to let you know how we did. But if you're curious, we can make that available to you as well.
Next question from Mr. Alan Mulder again. Why doesn't the VA receive funding to build housing, either temporary or permanent, for veterans?
That's a really great question too, and I'm totally speaking out of turn, but it really has to do with statutory authority. Congress would have to give us that authority to do that. And the only authority that they've done so far in terms of capital is the ability to award capital grants for transitional housing. So I would have to punt on that one for the rest of about why, other than we'd lack the statutory authority to do so.
Thank you. Next question from Lindri Rodriguez. Are there any programs available to assist veterans who are being displaced as a result of the rise in rental and housing costs, especially for transitioning service members post-housing allowances? Phoenix, and she says Phoenix housing costs has increased drastically over recent years.
So that's a really great question and very, very complex. The thing that I will say is that in many instances, the programs and services that I talked about today are the programs and services that would help veterans that would be displaced as a result of the rise of the rental costs. There are a little bit of nuances there, and the nuances really get into, you know, if the veteran is displaced, do they have other place to go, or but for us kind of coming in and assisting, would they be sheltered homelessness or street homelessness? I'm not aware of any specific resources that are narrowly tailored to, hey, you are eligible because you were displaced from rising rental costs. But in many instances, everything that I talked about, not everything, most of what I talked about today, in many instances, maybe even most, are applicable to the veterans who might be displaced due to rental costs, asterisk, depending on, you know, what resources, internal resources that they have on their own and where they would go. It's a really, really complicated answer.
Okay, just two more questions. This one from Glenn Dozier. What is the process to get housing certified for veterans?
That's a really great one too. So housing, so when it comes to, I'm going to use an example, a narrow example. We have a program, it's called HUD-VASH, HUD-VASH. It's a partnership program where VA provides supportive services, and HUD, through local public housing authorities, provide rental subsidies in the form of housing choice vouchers. In the context of that program, to get your housing certified, each housing authority is a little bit different. So I encourage you to reach out to your local housing authority. And I think we're doing a follow-up email. I can provide with the email to, a link to the housing authority locator so you can identify your local housing authority and see what is required to get registered as a vendor with them. The other part too is you're going to want to check out something called housing quality standards. That's actually a term that HUD uses, which talks about the standards of how each unit has to be in order to receive the subsidized funding. So it's like appliances and electrical outlets, all that stuff. So the short answer is check out with your local housing authority. What's the process to become a vendor with them? And then when you're ready to take the plunge, shoot us an email, homelessvets@va.gov.
Thank you, Shawn. Last question from Ronnie Carlisle. Can your system help veterans like me who has a house but need help with heating and some small repairs like windows, etc.?
That's a really great question. And I want to acknowledge that in the homeless program side, we don't work with veterans who have houses as assets. However, that's not to say that VA can't help. That I'm a little bit, you're kind of reaching the limits of my expertise. There may be some programs in VBA, special adapted housing, especially, you don't have to say any kind of patient care information here, but if you have any kind of disabling condition or other benefit eligibility. But then there might be some other kind of like philanthropic resources in your local community. If you too want to shoot us an email, homelessvets@va.gov, or call the call center, we'll get you connected to your local VA and see what local resources are available to you.
Thank you so much, Shawn. At this time, I'm going to turn the mic over to Mr. Washington for closing remarks.
Thank you, True. Shawn, thank you. You were awesome as usual. We appreciate you. Thank you for slowing down for the crowd. We know you're energetic and excited, but nonetheless, great information. Lauronzo, thank you for your welcome remarks today as well. We appreciate it. To all of you who joined, again, we appreciate you. We do this 3 to 4 times each month. Please go to our website and check it out. We thank you. Have a blessed and safe Veterans Day and weekend. Thank you.
Ladies and gentlemen, this concludes today's webinar. Thank you very much and be blessed.